So thanks everyone for joining tonight on this ORCCA webinar, Outcomes Registry for Cardiac Conditions in Athletes. First, just want to thank AIM-SSM for hosting it, and of course, Andy for helping set it up, and Steph. This is really important. This is an opportunity really for any AIM-SSM member to contribute to a research project and one like ORCCA that has to do with heart conditions in athletes. So just thankful for your time. I know it's earlier in the week and in the evening, and everyone's got lots of stuff going on, and late at night for those who are on the East Coast. So appreciate your time. What we're going to do is we have prepared just sort of a slide set to walk through the ORCCA study. Probably take us about 20 minutes to present the slides, and then I'll walk us through sort of a website tour, which is the first step for patient enrollment. And then we'll just open the floor up for some question and answer, and my guess is we'll be done before the hour is up. So we'll go from there. So what I'm going to do right now is just share my screen and bring up the slides, and then we'll go from there. So I'm going to put this in presentation mode. All right. Well, thanks again for coming to the webinar, and I'm going to pass this over to Kim to get us started. Oh, before we do that, Kim, sorry about that. These are the things we're going to walk through. Just for the agenda, we'll talk a little bit about the history of the ORCCA study and the rationale behind the project. We'll clearly define our study objective. Definitely want to go through our enrollment criteria and the inclusion criteria and diagnoses. We'll walk through our registration and consent processes, as well as our medical records and adjudication processes. Talk about the investigator team and our steering committee. Look at some additional resources, and certainly share our contact information. As I mentioned at the very end, we'll just review the website, which is our portal to the ORCCA study. So, Kim?
Awesome. Well, these first couple of slides were originally Aaron Bagish's slides, so if I don't do them justice, I apologize. It is 2 a.m. Aaron Bagish is in Switzerland, so he's opting not to join us later night for him. So I just want to talk quickly about sort of how the ORCCA study came to be. You know, this really started back in 2015 when the ACC and the AHA really changed their eligibility recommendations from a really paternalistic approach of you can't play, you can play, to one of more shared decision making. And so in 2016, ORCCA originally was conceptualized and talked about studying either how it went with shared decision making versus these paternalistic standards. And in 2020, with COVID, with the onset of COVID, there was really an opportunity for us to look at cardiac conditions in athletes. And so we pivoted a little bit from our original aims and goals to look at the effects of COVID cardiac in athletes. And so ORCCA phase 1 was born at that time. Can you move to the next slide, John? And so ORCCA phase 1 really looked at a couple of different things. It looked at the incidence and the implications of SARS-CoV-2 and cardiac complications in athletes. And many people really contributed to that study. We ended up having 42 different schools provide data for that, and so that was really terrific. We looked at the prevalence of long COVID in NCAA athletes and found out that that prevalence was quite low. We looked at different diagnostic approaches to cardiac screening after SARS-CoV, and as everyone remembers, we went through a number of different iterations of how we screen to now it just being recommended to screen based on symptoms. And we looked at the yield and pitfalls of large-scale screening. And so we produced a lot of papers and a lot of good information that I think really helped guide how we navigated through the COVID-19 pandemic. And so about a year ago or so, we really shifted to the ORCCA phase 2, which is what we're talking to you about tonight. And the primary aim of this study is really to assess cardiovascular outcomes in young competitive athletes that have cardiac conditions, and look at the impact of shared decision-making on those processes. And I can't read that slide completely because your faces are over it. Secondary aims also include look at how that decision get made, look at the psychological impacts of either deciding to continue to play versus not deciding to continue to play, and look at how the disease progresses and events that occur, and then changes that are made in emergency action planning when somebody with a cardiac diagnosis gets diagnosed. And so athletes that are eligible, currently eligible for this study, include athletes that are 18 to less than 35, so are college age and up athletes, but not too old. They need to have an eligible cardiac diagnosis or eligible borderline finding, which Nate is going to go through here in the next couple of slides. And then they need to be participating in a competitive sport, either at the collegiate, semi-professional, professional, or national level at the time of enrollment or in the 2 years previous to that. And we want people who have either decided to continue participating, and also those that have decided either voluntarily or involuntarily to stop participating.
Brad, we'll pass this over to you.
Awesome. For those who don't know me, I'm Brad Pedic. I was previously the sports cardiology fellow at Mass General, and now have started practice at OHSU. And really excited about this study. So for the conditions that meet our diagnostic criteria, it's pretty much any young athlete with a significant cardiac condition. So those with a history of cardiomyopathy, those with primary electrical diseases, including channelopathy. So this includes WPW, whether they've had an ablation or not. Those with unexplained cardiac arrest, those with myocarditis, those with significant coronary disease or anomalous coronary arteries, those with congenital heart disease, those with valvular heart disease, and those with aortopathies. And we'll talk a little bit more about the nuances here on the next slide. So for primary electrical disease, so this is pretty much any significant arrhythmia that including WPW, significant VT, if you have greater than 10,000 PVCs, would meet criteria in that category, or unexplained sudden cardiac death. For congenital heart disease, we're really looking for moderate or greater congenital heart disease by the American College of Cardiology guidelines. So this excludes isolated ASDs or VSDs, PFOs, or repaired PDAs, or repaired ASDs and VSDs without residual shunting. For valvular heart disease, we're looking for anyone with moderate to greater regurgitation or stenosis, or those with a bicuspid aortic valve with significant aortopathy. And then finally, for aortopathy, anyone with a known familial syndrome, such as Marfan syndrome or Loeys-Dietz syndrome, or those with an absolute aortic dimension of greater than or equal to 45 millimeters in men, or greater than or equal to 40 millimeters in women. And then as far as post-procedural conditions. So if you've had an ablation for WPW or an ablation for your significant arrhythmia, then we'll still want to capture those. And also if you've had a valve replacement, an aortic surgery, or if you've had the placement of an ICD or a pacemaker, those are all eligible for enrollment. We also included borderline findings that have potential risks. So those include athletes with an abnormal ECG per the international criteria, but normal cardiac imaging. Those with isolated borderline LVH with the measures there. These can all be found online too. Those with borderline aortic dilatation, which is 40 to 44 in men and 34 to 39 in women. Those with SCAR on a CMR, we'll talk more about that. Those with non-compacted LV myocardium, which with concerns for LV non-compaction. Genotype positive and phenotype negative for cardiomyopathy. So let's say you have a lamin A mutation in a family member and you get tested. So we'll want to follow those too. And then an unexplained reduced left ventricular ejection fraction of 45 to 50%. And then we'll go a little bit into the nuances about these. So for the subclinical scar, we found that a lot of athletes will have isolated insertion point or papillary muscle fibrosis. So we want to include only athletes with scar in different areas and exclude RV insertion or isolated pap muscle fibrosis. And then unexplained reduction in EF. These would be athletes that are not participating in endurance sports. So it's not uncommon that we find like long distance runners that will have a big dilated heart and they may have a slightly reduced EF. And then clinically significant PVCs, you can see there more than 2,024 hours of a non-outflow tract origin and greater than 10,024 hours of an outflow tract origin. And I think there's a really good BJSM paper talking about how to say if it's an outflow tract organ or not by Corrado et al., if anyone's interested.
Thanks, Brad, and good call out to BJSM, of course. So appreciate that. Let's talk a little bit about the registration and enrollment process. And we tried to make this as straightforward as we could. And so as a sports medicine physician, as a team physician, if you're seeing an athlete who you think is eligible for this, you can go to our website. On our website are the eligibility criteria and diagnoses that Brad just went through. So if you need a reminder that those resources are there. But more than anything, what we'd like you to do is just go to the website and click the red register button. And you'll see here number 2, what will come up is another screen and a form to fill out. The form is really simple. It's basically your information and the patient's information, just name and a contact phone number and email. And then our study team will reach out to the patient, provide more information to the patient about the study. If they agree to participate, we'll get formal informed consent and also HIPAA forms signed. This is all done electronically using REDCap, and the consents as well as the surveys to follow can go to their phone or they can go to their email. And then we capture all the information in the REDCap system. And then ultimately, if they do enroll, we're going to circle back to you and ask you for some medical records. And we have a secure electronic fax, which is the best way to send us a large PDF of the medical records. I want to pause for a second because a lot of people have asked questions in the past about whether or not they can provide patient information through a study portal like this without the individual actually providing consent. And the answer is yes, you can. The University of Washington Human Subjects Division, our IRB, has approved the study. This is pretty routine process to refer a patient to another study. So imagine that you're seeing an asthma patient in your clinic, and you know the pulmonary division is having a big asthma study, and you want to provide the pulmonary clinic just the name and information of the patient, and you've introduced that to the patient in the clinic, hopefully, so they know what's coming. So this is pretty straightforward and does not require you to have IRB approval through your institution, simply to provide the patient's information through our study portal. Laurel?
Yeah, so sort of to follow up on where John left off, when participants are registered or they self-register, the study staff, myself, and Amy are notified via email. We then facilitate a time to discuss the study, go through the informed consent, and we'll set this time up through a phone, a call, email, or a text, kind of whatever the participant prefers. The consent phone call is taken on average like 20 minutes, depending on, the questions that participants might have, their understanding. And once we're able to confirm the participant has, comprehension of the information presented, we will then send them out the consent form. And this is done, as John mentioned, electronically through REDCap system. And once signed and received, they will get a copy of that sent to them to their email. And then automatically the HIPAA form is sent out from REDCap for them to complete and provide their physician information and the location of their records. They must provide this information to move forward with the rest of the surveys. And the patient information that's released is related to the research, and it's typically, it's all listed below, but primarily relates to their diagnosis history and treatment.
Thanks, Laurel. Once we get that information, again, we're going to circle back to you to get some medical records, as well as records from consultants and other cardiac testing that's been done. All of this is stored in REDCap as a study team. Once we acquire those records, we will review them and ensure that the patient truly is eligible to participate in the study, go through the data diagnosis, adjudicate the diagnosis to make sure that we agree with it, etc., and go from there. This is a summary of the ORCCA study that we published in our protocol paper recently. And just to take a step back, again, we're looking for athletes with heart conditions at risk for sudden cardiac arrest or sudden death. Most of these are known entities, pathologic cardiac disorders like cardiomyopathies or primary electrical disease. And we also are including some of the borderline findings that Brad went through. These are sort of conditions that we don't necessarily think are a problem, but we're really not sure, and they deserve more data and surveillance. And our goal, once they enroll, is to monitor them over time for adverse cardiovascular events, quality of life, and mental health, as well as some information about the shared decision-making process. So if you go down to the sort of yellow stream at the bottom, once they do enroll, we're going to collect some information from them, and then they'll be contacted again every 6 months in follow-up. There's a $100 incentive for the patient to enroll initially, and then a $50 incentive if they complete the 6-month follow-up surveys. So far, we estimate that the whole survey collection takes about 10 minutes to complete, and they can do it on their phone, and they can do it online via email. We've created some just demographic surveys, sports participation questions about shared decision-making, questions about adverse cardiovascular events, even some individual emergency action plan type questions. We use the Global Physical Activity Questionnaire, the GPAC, to understand their physical activity levels. And then we use the PROMIS to understand quality of life, GAD-7 and PHQ-9 for anxiety and depression, which everyone is familiar with. So these are some of the validated surveys that we're trying to use over time to monitor them. I also wanted to point out that we are for sure wanting to collect and enroll athletes, whether they continue playing after their diagnosis or whether they stop playing. And so more and more athletes are returning to the field or returning to the court or returning to their sport after a shared decision-making process. But some athletes are still choosing not to play or perhaps are medically disqualified from play. And we want to collect that information and that patient just as much to follow them over time to understand whether or not stopping sport was safer for them or better for their quality of life or mental health, or vice versa, playing sports was also safe for them or better for their quality of life or mental health. Tim?
So for those I haven't met, my name is Tim Churchill. I'm a cardiologist at Mass General in Boston. I've been working with this group here for the past couple of years. And the key point I want to make on this slide here is that this study doesn't succeed and doesn't provide the data that we all, and hopefully you all, want and need if we don't get broad buy-in and support and participation from the whole community, from cardiologists to sports medicine doctors and beyond. So I think that's really the central message we want to communicate here. As you can see here, we have kind of a core group of study investigators, as well as the other folks on this page here are members of our steering committee who've been helping kind of work with us over the past couple of years to design the study. And we've also defined what we're calling contributors. And this really comes out of the idea that we want to be very clear that we recognize that everybody's busy, everybody's stretched thin, and so we've created this idea of contributors with the thought that when people are active, what we're saying, active enrollers in ORCCA, which we're defining as enrolling at least one athlete per year, that they would be recognized in future publications in a listing at the end of the manuscript and registered in Medline. And then, you know, we'll sort of see how this evolves over time, but then also the possibility of if someone becomes a very engaged contributor and is really contributing a lot of study patients and they're interested in future kind of expanding that involvement, that's also something that we'd be open to in the future. But the key point is we really appreciate that everybody's taking their time tonight, and we really want as many people as possible engaged, participating and supporting the study, and we want to recognize that on the other end, on the outputs, with what we think will hopefully be important publications that come out of this as well.
Thanks, Tim. And so to round up, for those on the webinar, if you do have questions or want additional information that we haven't provided tonight or in our QA to follow, feel free to reach out. And listed here, just emails for myself, Kim, and Aaron Bagish. You could also email Laurel, who you heard from, who's our project manager, or Amy Jest, who's also on the call, who's our study research coordinator. We have prepared information for patients in a sort of a trifold patient information packet. And we also have these sort of reminder cards for physicians, you know, how to enroll, and also the inclusion criteria. Some of these were in your bag if you attended AMSSM this past year. So you might have had that, so hopefully you held on to it. If not, and you need a copy, let me know or let Laurel know. If you feel like your clinic sees a high volume of potential you know, patients that would be eligible for the ORCCA study, you know, if you work a lot with cardiology or sports cardiology and you're in that space and you want just some of these patient pamphlets available, you know, again, let us know. We're happy to send you, you know, a dozen or more, you know, just to get you started. So we appreciate that. Remember to go to orccastudy.org if you have any questions and can learn more information. I'm going to stop my screen share right now and just move to a different screen share so we can show you the website and walk through that. So just 1 second here. Find you guys again on Zoom. All right. Can you guys see the website? Tim, can you give me a thumbs up? If you see the website, great, perfect. So this is the ORCCA website, and really straightforward, and just want to draw your attention if you're gonna see what's happening here on the website. You know, when you come to the website, you can get different information about the study, more information about the investigator team if you're interested. But probably there's information about on this area called the FAQs for more information, past publications, etc., contact information. But the most important place for you to go is this red register button in the upper right corner. So if we just click that, it brings us to a new screen. And as you scroll down, there's 4 simple steps about what's going to happen. And there's this form to fill out, which is really straightforward. You can also refer your patient to this website and they can register themselves. So we have 2 different forms. One is if they're going to register themselves, and one is if you're going to register them. So as the treating you know, physician, you would just walk through this, that you're the physician. You give us your name, your email, phone number, the athlete's name, their email, and their phone number, and click register. And this doesn't mean they're enrolled in the study. This is simply passing along that this is a potential eligible athlete for the ORCCA study. And then again, we reach out to them. We have found as the study group that this is best done with the athlete in the examination room. You tell them about the study as you're walking through maybe what's happening in the shared decision-making process, or at a moment in time when they're ready to absorb some of the information about the need for better evidence and long-term data. And then you bring this up and you go to orccastudy.org, go to the red register tab, fill out this form, and the whole thing probably takes about a minute to do. And then they're aware of what's going on, and you've sent this information to the study team real time. just wanted to show you for our frequently asked questions, if you do have additional questions about the study, this is going to get updated pretty soon on the website, because there's going to be a specific section for physicians and not just the patients. But you can also refer the patients here about ORCCA and what will be happening. And each of these has a nice answer to it. Perfect. So I'm going to stop there and just sort of open the floor for any questions from our colleagues who have been kind enough to join the call tonight. We appreciate that. And let us know what you think.
Hi guys, it's Mike Freitas out in Buffalo. John, I was happy to talk to you the other night and looking forward to this. I just have one question. My partners and I, we take care of a lot of college athletes, but also some pro athletes at the NHL and NFL level. Do you run into any issues with like players associations and unions and stuff? I mean, one of our football players had a very public cardiac event around New Year's Eve. And, you know, just wondering if the players associations and unions and stuff like don't let them participate in stuff like this.
Yeah, that's a great question. We actually have some chief medical officers on the call that they could provide as well. Having said that, you know, this is a patient level consent study, and so we actually don't need the approval of our Players Association or, you know, the NFL or NHL or MLS or whatever to include an athlete who wants to participate in this study, because it's a patient level consent. It's a little different. I work with, you know, with the Seahawks and the NFL. If we want to do research on NFL players specifically and use their data, et cetera, almost without them, sometimes without them fully signing the consent, just part of their CBA or whatever, it has to go through a pretty robust NFL research committee and approval process and stuff like that that goes with that. This is different. This is patient level, and I think it sort of bypasses the need to have approval from the league or the Player Association. Of course, we hope that the leagues and the Player Association would encourage athletes with potentially risky cardiac conditions to join the study.
Yeah, I'll just throw in there as the deputy chief medical officer for the NHL. This is not something that we would consider within our purview to sort of allow or not allow. It's an individual athlete choice, and so I hope that all NHL athletes will participate. Of course, I will not be soliciting them, but yeah.
Hi, this is Cindy. So obviously we have many team physicians that are part of the professional league. So I'm with the NWSL, but how would you, I mean, it would be great, right? We oftentimes will be consulted about potential issues regarding clearance, et cetera. And recently just was, it came up to the league medical. But how would you suggest is the best way for us to make sure that our team physicians, you know, of the leagues with which we belong to, whether or not it's a collegiate conference or a professional league, how would you recommend we get this ORCCA word out to them? Is there a easy email that we can then forward to them? We can certainly, so appreciate your suggestions. Like, so for example, Kim, how are you getting the word out to all the NHL team physicians, et cetera, about ORCCA, or just in case they have these issues at their team level?
Yeah, so quite honestly, the league does not want to be seen as promoting this or not promoting this. And so I think that, you know, from a investigator standpoint, I can promote it, but from a league standpoint, I really can't unless somebody asks me about it. Not every league is going to take that stance. If you feel, you know, comfortable, we'd be happy to provide anybody who wants to send emails or introductory material or anything like that to their friends, their relatives, their leagues, their teams. We're happy to provide those emails and that material for you to send out.
Yeah.
Okay.
Yeah, Cindy, we definitely could craft for you, you know, because we've done this for foundations and things like that, you know, an email that has active links. We can attach the pamphlet and enrollment cards and stuff like that. So we could definitely sort of do the work. And then have you and Huey sort of send it out to the team physician crew, or just approve it first and then send it out to the crew. This is simply awareness about the study. Doesn't mean they'll actually engage in it, but hopefully if they do have an athlete that seems like they have a cardiac condition at risk for sudden death, that they would think about ORCCA.
Okay, I will reach out to you guys because we're doing a, for those of you who know about that Smart Heart Coalition, all built around, sudden cardiac arrest awareness. We're doing something for our championship game. So let me know who to contact so we can get like a poster board from you with a registration that and because there'll be many people visiting the booth, hopefully, right, to participate. So that would be a thing that we could advertise for you guys during that championship game for the public who are coming up to visit the booth, et cetera, and then they could become aware of that as well.
Sounds great.
One of the things that we hope by reaching out to AMSSM physicians is, AMSSM physicians are team physicians. A lot of times they're the people with the relationships who have these conditions, and just really to make sort of awareness so that when you inevitably during the course of your career run into these people, that you can direct them this way. Because we've all struggled with advising patients on what to do, so this information will be really helpful down the line. And so we just want to reach out to the people with the boots on the ground that have the relationships with the athletes that hopefully can encourage them.
Thanks, guys. This is Margot for MLS. I'm just, we have Matt Martinez, so we're on board, and we're definitely supportive. And I think this is a win-win for all of our players. And so thank you for all the work you're doing, and we hope to contribute.
Thanks, Margot.
Hey, John. Dave here. Just thinking about the mass participation, the pre-participation thing that we put on. A lot of those kids are less than 18 when they're diagnosed. They're competitive, but they may turn 18. Is this something they could get into a year or two, after diagnosis, as long because we're following them anyway?
Yeah.
And if that's true, do they still have to, like, say they played sports in high school, but then they hit college and they're still not competitive anymore? They're just, former athletes. Is that kind of rule them out?
Great question, David. And I anticipated that you were going to ask something about the high school age athlete.
Mm-hmm.
So right now, we can only enroll individuals who are 18 or over. At some point in 2024, we will likely have the processes in place to enroll minors,
Okay.
and include our high school population. So, but for now, it's only 18 or over. If the person was, it doesn't matter when they were diagnosed. It just matters that at the time of enrollment, they were a competitive athlete within the last 2 years. So if they were playing through high school, are now in college, but aren't playing college sports, they would be eligible.
Okay. Super helpful. Thanks.
Are you guys pursuing international players as well? Because, we're aware of players who are international players who may not have signed within the league, but have a condition. And are you guys pursuing those athletes as well?
My understanding is we are if they're playing within the US.
So it's just within the US. It's not within their national team in Europe or outside of the US.
Correct, not yet. We have one of our co-investigators is at University of British Columbia now in Canada, in Vancouver, and we have their IRB is almost through. So pretty soon we will have ORCCA Canada up and running as well. And so now we'll have 2 countries that if the athlete is basically participating, that we can enroll in.
That's helpful to know. Thank you.
John, I have a question. This is Jennifer Mitchell. I have probably 4 potential cases, but each one of them has a little quirk that I'm not necessarily sure. Is it this form okay to ask those questions, or is it better if I just speak with one of y'all directly?
Either way, honestly, if you want to put that in a form or a question, that's fine. If you want to email us, if you just want to have a phone call, whatever's easiest. Be
Because
happy
I
to just
think I
walk
could
through it.
ask, I think I could ask pretty quickly. They're pretty short.
Yeah,
it's-
absolutely. I don't know if you want to do it with the whole group. So if you want to have a separate call with like me or Kim or something like that, we'd be happy to do that. If you want to ask it for the group without giving information, that's good too. I bet you everyone else on the call will be interested to know our answers.
Yeah, I just don't want to hold anybody hostage, but just real quick, one is an 18-year-old coming into college, diagnosed with an ASD that was repaired as an infant, then with a VSD that was repaired as a child, and now as we're doing all of our screening on him, has a bicuspid aortic valve. And our cardiologist said that it was basically almost like an incomplete tetralogy. Would he fit criteria?
Yeah, that's it. So you asked basically the toughest question possible. So thank you, Jennifer. So the congenital heart disease category for inclusion is complex, and it needs to be complex heart disease. I would argue that repaired ASD and VSD as a kid is not complex anymore when they're older, and that alone may not bring them to our study. A bicuspid aortic valve alone does not enter the study, but one that is associated with aortopathy would, or one that has more significant stenosis and meets that criteria. So Brad is on the call, and so is Tim. Maybe you guys want to weigh in on what Jennifer presented.
That was basically my takeaway there. I think
And we're waiting on his cardiac MRI to look for the aortopathy, so we don't have that back yet.
what I'll say also is I think that one certainly sounds like it's got a lot of nuance there. So that's certainly the one where it is, if there is, the devil's always in the details. So that, we're certainly happy to kind of engage with those details. But my quick response was in line with what John said. Brad?
Yeah, I totally agree. It's a very complicated case that doesn't really fit in any keyhole well. So I think if they have aortopathy, I would put them in, but probably otherwise not.
And then another one we had last year was a very complicated, it was a cardiomyopathy. And they were on 5 medications. So we ended up not clearing the individual to play for our university, but they did transfer to another university. So I know that they did play last year. And so the question is, do I contact the team physicians that may be handling that person now? But I don't know that she disclosed to them her heart condition. I don't know how to handle that one. And it was kind of contentious, her leaving, so I don't really feel comfortable calling her and saying, hey.
Yeah. If you're not comfortable talking to the patient, I would probably try to contact the team physician if you're willing to, and just, hey, did you hear about this study? This might be applicable to, this patient, and see if we can get them on board.
Okay. I just didn't know if that, it was a HIPAA issue, maybe, if she hasn't revealed to them. I imagine she probably has revealed to them, but anyway. Okay, and then there was a local event with a football player, high school football player, who I think now is 18, and had sudden cardiac death, had CPR, had AED, but I wasn't involved with him. Is that appropriate to try to contact him somehow through his parents or something to try to let them know about this?
I think so, if you're comfortable doing that. We get media reports for various reasons in different studies, and sometimes if I see a team physician's name, I just email them out of the gates about ORCCA for SCA survivors. So I think that's reasonable. Contacting families after SCA is sometimes hard. They don't always want to respond, but if you're willing to do the work, we'd appreciate it.
And oftentimes, patients actually feel like by joining the study that they're doing something that's positive, and it gives them a good feeling to be sort of contributing to things, like they're helping. So some athletes really feel good about joining the study.
Okay. And then last one was somebody that had WPW ablated, but has now moved on to a different university. So again, I'm not sure that about contacting the patient, the student athlete versus contacting the team physicians there. So
Yeah, probably just need to weigh it for yourself. I think contacting team physician is pretty easy. If you have a good relationship with the athlete still, that might be something you can do.
okay, thanks, y'all.
Thank you.
Hey, Jennifer, go Bears.
My daughter just started law school, so
Awesome.
thanks.
John, that raises a question though that I think might be helpful. If there is a situation, because when you put up the slide related to the different conditions that you're looking for, if there's a question as to whether someone might be eligible, who would be the contact person?
Any of us. Yeah.
Okay.
So reach out to me, Kim, or Aaron.
Yeah,
is
to
what
sort
I'd
out like,
suggest.
you know, whether it really reaches that criteria of whether it's eligible or not.
Yeah.
All right.
And if it's MLS and it's going through Matt, you know, Martinez, Matt can answer the question as well.
I figured as much. Thanks.
We sort of trust him. All right. Any other final thoughts from our ORCCA team or anyone else on the call?
Just really appreciate everybody taking the time tonight to listen to this. We love any involvement that you guys or athletes that you guys like to contribute. It'd be great to help make this project successful. Appreciate you.
Yeah, really appreciate your interest. And again, feel free to reach out, drop us a note or drop us an email. Any questions come up. So thanks so much, everybody. Have a great rest of your night.